Good afternoon. My name is Barbara Del Prince, and I'm the Director of Marketing for GE Healthcare Women's Health Ultrasound. And I'd like to welcome you all to our Satellite Symposium. You know, I've been very fortunate over the last 11 years to be able to introduce these symposiums, and I think today is one of the most exciting moments for us as we're introducing a new product. But I think one of the things that also I love about ISWAG is the fact that we're meeting with all of our customers, and everyone is always pushing us to think bigger, be bolder, and to always be pushing the envelope in innovation. This afternoon, I am really honored and excited to be introducing three giants in women's health ultrasound who have been working with us for the last several years on the development of our new product. I'd like to not only thank these physicians, but also all the physicians around the world who really worked with us to develop this machine over the years. Today, to talk to you about our new system, I would like to introduce Professor Alfred Abu-Hamid. Professor Abu-Hamid, I'm sure needs no introduction, but is the President, Dean, and Provost of the Eastern Virginia Medical School in Norfolk, Virginia. Also with us, we will have Professor Robbie Chowie. Professor Robbie Chowie is the Medical Director of the Prenatal Diagnostic Center coming from Berlin, Germany. And also with us will be Dr. Bernard Benoit. Dr. Benoit is joining us from Nice. He is always pushing our team and especially our engineers to drive more in imaging, and we're really excited to see what all of these three gentlemen have to say about our new product. So thank you.
Thank you, Barbara. Thank you, everybody. I want to take this opportunity to also reflect on the incredible contributions that Dr. Benas Arafat had on the organization here, and certainly the mentorship that she's had for many of us, and her legacy continues extensively in the field of ultrasound. So I would like to thank the GE team, the engineers, for inviting me to speak and share my experience with the Vuluson Expert 22. I want to disclose that EVMS is a luminary center for GE Ultrasound, and then EVMS and GE Healthcare have research agreements. So I started by reflecting, what do I desire in an ultrasound system of tomorrow, and trying to think and expand into what the ultrasound system would look into the future. Certainly, I would like to have exceptional spatial and contrast resolution. That's what we really do on a day-to-day basis. Want to enhance our tissue penetration, especially to help with challenging patients with regards to ultrasound. We want to improve my tissue characterization. Color and spectral Doppler resolution and sensitivity becomes key to the evaluation of the fetus and many GYN applications. More than ever, want to optimize the workflow efficiency. I want to make sure that the ultrasound is quite efficient and smart enough to reduce, waste time and minimize work-related injuries. I want to have a lot of AI in my system because really I want to apply a lot of these applications to improve efficiency and quality of the ultrasound, and certainly intuitive ergonomics and advanced volume imaging. After a very long gestation that lasted almost 2 years, the Vuluson Expert 22 is here, and I'm hoping to impress upon you. It is really quite impressive. So let's take a look under the hood and see what makes the system quite impressive. First, the system has graphic-based beamformer technology that really reflects on a higher quality images and more flexibility in imaging functions. It has customizable touch panels that you can adjust the color and lighting, but also the placement based on what you fear is more optimal for you ergonomically. It has packed with artificial intelligence that really allows you to have consistency in the exam, reduce tasks of the sonographers, and has applications, SonoList, SonoPelvic Floor, and SonoCNS are targeted to specific examinations. The monitor is 24-inch HD monitor that can give you 3 image sizes or can be fully conveyed to provide the full ultrasound image on the screen. And the architecture design is a lyric type architecture that gives you deep penetration into tissue, enhanced resolution, frame rate, and uniformity in the image. So this powerful engine really translates into innovative and impactful clinical application. Let me share with you just the brief images from my perspective. I'm introducing the system, and Rabi and Bernard will go into much details with regards to the capacity of the system itself. There are several new applications in the system and certainly enhanced applications from before. Automatic activation of the probes as you pick them up from the probe handle. The slow flow is optimized with HD slow flow with certainly the radiant features that you've learned from the E10. We have several applications that relates to 2D imaging that includes a radiant mode in minimum, moderate, and maximum, the Ultra HD, and an augment, which are features that are specific for challenging patients. The SonoList application not only provides quality of the images that you obtain, consistency in image design, but within each image, if you miss some of the specialized criteria, gives you an alert to what you have not obtained, and also a substantive expansion in the 3D functionality of the system to really allow you to do some expensive, really high-quality post-processing of volumes. So if you look at this, this is a 2D image obtained of a normal 4-chamber view, obtained with what we call the radiant 2D flow. This enhances substantially your border visibility. You could see the myocardium here with the outer border of the myocardium really highlighted. It gives you a 3D-like image in 2D, and I find it very applicable in the brain and the heart. This is a 4-chamber view of a fetus with atrioventricular septal defect, both obtained with the radiant maximum application, but also with the Ultra HD. The Ultra HD increases axial and lateral resolution of the image, improves the finer details of the images, and its application, at least for me, is most impressive in the brain, the heart, and the first trimester. And if you see on this, in this fetus, you see that there's a collector vein that is sitting right behind the heart in a case with the total anomalous venous return with atrioventricular septal defect. As you know from your traditional 2D imaging, seeing the collector vein is sometimes quite challenging. This is highlighted quite nicely in this image here. This is an 18-week fetus with the C29 probe with the standard applications, and this is using Ultra HD on the same fetus with the radiant in 2D. And you could clearly see the definition of the corpus callosum, the pericallosal sulcus right here, and the details that you see in the brain. Here's a 26-week fetus using the abdominal C29 probe using the Ultra HD that provides a lot of the finer details in the tissue. And you could see the details that you see right here in this coronal view. And if you look at this sagittal view, you could see the details that you get within the brain tissue itself. Certainly details that we have not seen before. Look at the vermis and the details that you see at the vermis several centimeters down into the image itself. Also, there are smart applications in the system. This is a 4-chamber view with color in a standard way, and you can customize the system with something called flow profiles that allows you with one touch of a button to go from looking at the 4-chamber view in color to looking at the pulmonary veins without having to adjust the scale, the filters, the gains, and so forth. Very, very useful. Increase your speed of scanning. And you can do this not only in color Doppler, but also in spectral Doppler, as you see right here. This is a fetus at 11 weeks using the abdominal C29 probe. You see there's an abnormal 4-chamber view. Color flow and radiant flow using the mid-level shows just flow from one side of the heart, and the 3-vessel trachea view is abnormal with only the pulmonary artery. That's a hypoplastic left heart syndrome at 11 weeks gestation using the abdominal probe. See the new slow flow application in high definition in combination with the 2D radiant flow, using some 3D applications looking at the blood flow in the brain. Again, at 12 weeks, using the intracavitary probe, the 5 to 9 intracavitary probe, using these two applications displayed. Again, you will see a lot of great images from Rabia and Bernard on the quality of the 3D and some modern 3D applications. He's showing you a thin cleft lip in this fetus displayed on 3D ultrasound. Again, some 3D applications looking at brain vasculature, liver vasculature. This is a 30-week fetus with bowel obstruction using a 3D volume with inverse mode. You see the bowel loop all the way down throughout the abdomen. A GU abnormality using the electronic 3D probe and using inverse mode with some lighting effect. You see the dilation of the pelvis and the ureter all the way down into the pelvis, into the bladder. And this is just the pulmonary sequestration in 3D showing you both the arterial and the venous flow. So in my experience, having evaluated the system for about 1.5 years, I believe this is a breakthrough platform in OBGYN imaging. The image is exceptional in quality and the details that I have not seen before in my evaluation of the fetal imaging for a long time, and has a lot of innovation, has significant AI that brings the system in the forefront of ultrasound today. I say traditionally, when we looked at ultrasound, we looked at a technical component of the ultrasound, right? So using the ultrasound system to generate the images, and then a professional component of the ultrasound is looking at the interpretation of the ultrasound images. What I believe the Expert 22 does is really substantially blurs this distinction between what's the technical and what's the professional. The system itself provides a lot of aids to really interpret the images and give you information about not only the quality, the compliance with the guidelines that exist, and certainly a lot of AI that are built into the system. So the new Vuluson Expert 22 is indeed, in my opinion, the ultrasound system for the future. Thank you for your attention.
So thank you, Alfred, and also from my side, good afternoon. And I'm really proud to have the opportunity to have used this machine for the last 1.5 years. And I want to share also with you our experience in Berlin. And just at the beginning, because people ask me often, what is new in the machine? Is there anything new? I think there are many, many new things. And I wished we could have a lot of time to show you all of this. But looking to this new platform, we have not only new image quality criteria like developing radiant and ultra HD and the other thing we'll show you, but also a lot of changes in the workflow which made a new system needed. And at this stage, I want just at the beginning give big credit to the engineers, to the team of GE who were really working very hard during the pandemic to make such a wonderful product possible. And it was really not easy to work on a remote, to bring a machine despite the border closed and so on. And really, I'm very happy that we are there today and share with you some of our experience. So let's start now with the beginning. And Alfred told you before that with this new system, we have, let's say, the new version of Radiant on grayscale, which makes the image appear like in 3D, and with the Ultra HD, as you have seen before, so the details can be very well seen, like the corpus callosum here and the vermis, and look at the conus medullaris with the lines, and also with looking to the brain and the axial view, you see the bones are quite thin, which is the normal bone. It's the other one are often exaggerated without these tool, and you even can recognize here the third ventricle and so on. For example, here on the level of the face, we see the profile as we are using, but if you look at more carefully to other details, you see the eyes with the lenses, the nose, the tongue. But when you look at the maxilla here, you don't only see the hard palate, but also the developing teeth here. And this is the ear, the shape of the ear on 2D, but appearing like third dimension as well. Oops, sorry. If you want to get a higher resolution, you can be welcome with this technique. So this is where I test for years machines. When I have a new machine, I want to test what is the kick of the new resolution. I was for years looking to the thymus, but look now today, of course, the anus will be easily seen, the pancreas with the pancreatic duct, the esophagus, and also the trachea, and even the optic chiasm can be seen on an axial view. The issue is that we don't only have a high resolution, but we also have a very nice discrimination between the different layers. So it makes the borders of the structure very well seen and disposable. Let's move now to the fetal heart, because this is one of our favorite tools and organs examined. And you see here that we are able with this new technology to demonstrate the endocardium and the myocardium very nicely. And also, because of the high contrast, also the veins, and as you have seen the case before with Alfred, let's say the true connection of the veins. And the combination with color Doppler enable us to show, let's say, the feeling on one hand, but also look at on the left-hand side this nice discrimination of the valves, and we can perform, of course, like in the past, a very accurate color Doppler examination. But even with this technique, you can have a nice combination to produce the best image done. I would recommend you, if you are going to test the machine, to try this thing. I would recommend you to use, for example, Ultra HD with Radiant Maximum, for example, and HD Flow. And while you are using it, for example, to demonstrate the aortic arc, reduce the balance between the grayscale and the color. And this is the result, what you will get. Then you will see clearly the aortic arc, but also the vessels raising to the neck. And because of the maximum radiant, you can see inside the heart even the valves moving out of the picture. And this is only 2D with a combination with these radiant and with this radiant of color and radiant of 2D as well. Now, Alfred told it before, but I cannot emphasize enough this issue. In the past, when I was giving a talk on color Doppler and so on, it's easy if you want to move from the normal color to the lung veins. You simply need to reduce the velocities, so the PRF, then reduce the filter, augment the gain, and augment here, and do this. So you have 5 steps. Today, you don't need to do this. It is one button away. So what you'll do here, you hit the button of pulmonary veins, and then that's it. This is 1 second, and you have within one view this picture, and you can go back to the fetal heart. So we have 6 different displays. For example, for the uterine arteries, you have, after you stop the image, you have automation of the measurements. So it will really accelerate your examination time. And this is at the beginning, you think, I may not need it, but once you are using it, if you go to another machine, you see, oh my God, how much time I was spending touching knobs the whole day. So this is why it will really accelerate your examination time and let you focus on the essential during the examination. So, and then, because we have a very, very good 2D image, it is the basis of having 3D picture. So with this system, of course, you can do even better images. And I used to say sometimes in some talks, with this system, everyone can become a Dr. Benoit. But while we are getting to the level of Benoit, Benoit is now getting to the Benoit 2.0. I will show you later on. So I think we are almost there, but he shows us later something, say, oh my God, then we need to hurry up for the next future. So, but it's not only the classical images of the face, but it's also very comfortable in using it for the multiplanar imaging, abdominal or transvaginal, like reconstruction of the corpus callosum, but also for a stick and for, here, the case of a right aortic arc. But also with the new techniques like here, this was done with an abdominal RM7C, the pericallosa with the straight sinus or the spine. And in the past, when we were acquiring a volume of the chest, I remember 15 years ago loving these images of the transparent mode. Today, we can show them as an organ inside the body with this new transparency in combination with the silhouette. So when I show these images, people tell me, I wished I could do and could learn all of this. So we'll show you this later on the machine. But you see, this is, for example, transposition of the great vessels and demonstrating here the bifurcation of the pulmonary artery, but also the aorta getting over the pulmonary artery in a TGV. And then people say, okay, I wish I was working in Berlin because you have very slim patient there. You show us only the thin patient. I wish our patients are not this size. So, and then in the past you said, okay, so I'm sorry for you, but today we have a new tool, which is, as Alfred was saying, it's called the Augment. So in every one of us, when he's scanning a challenging, acoustic challenging patient, that I need some help, I cannot see anything in this brain. So you need the help button, and this help button is called Augment. And you push the button, and it's like someone putting a torch and lighting up your image. So I'll show you a video to see how this works. So this is here BPD, and you say, oh my God. So I'm using this tool probably 5-6 times a day. I don't see anything. I push the button Augment, and you see inside the brain. You can look at the lateral ventricles. You can look at the Sylvian fissure. You can do the measurements, and you can return back. You can do it for the heart, and so on. So really, this is something amazing. It's not about playing with the 3D, but it is everyday's work for everyone. But once you have a thin patient, then you can go really into the highest resolution, like in first semester. I remember, I will say yesterday, but some years ago, it was these were one of our best images, and we used some of these in our first semester book, and we were so happy to get these images. Today, I will not even store this one because we have even better. The resolution has increased dramatically with the combination of the ultra high definition in combination with the radiant. And by magnifying this image, you see now how the border of the structures are clear, and you see how thin the skin is over the nuclear translucency to be measured. And I will show you here, this is a video clip, and you see here on the border the Ultra HD and the Radiant. So at the beginning, I'm sure many of you who have not used the system may think, oh, it's too much grayish and too much contrasty. This is why I will recommend you to start with the Radiant minimum, because you can go to mid and to maximum. Bernard is now used to look at maximum. I use occasionally maximum, but I'm still between minimum and mid, because this is my eyes need to get used to. But one of these days, we cannot return back. And at the beginning, you will use it for some weeks, and you say, it's not something new, and you go and you work on your E10 and say, no, I cannot work anymore. I need to do this. This is the experience we had, all three of us. And so, in other words, this is what we have today, images. And you see the lower one here is transvaginal examination, the other one abdominal. So they look almost similar because we see all the details from the nasal bone to the thalamus to the IT and the bones and so on. So I had this week fetus. Here you see it's 14 of September with the trisomy 21. You see the absent nasal bone. You see the thickened nuclear translucency. She came with an NIPT, and it was with one view I could demonstrate that it's clearly seen, and the image is so clear that everyone can recognize what's going on. What I also really appreciate, and this is sometimes when I look at a picture, I say, how did they develop this, that we have in a region of 6 centimeters, 5 centimeters, so many 7 different gray shadowings, from the black fluid to the white bones, the gray lung to the dark gray liver, to the adrenal gland, to the kidneys and the bowel. And you see all these different shades of gray can be very well recognized in this simple image. It means that in other regions you can also appreciate also the resolution increasing. And this is why when we'll be hearing afterwards the first semester new recommendations, these are the images we can produce today on a first semester scan, in ideal conditions, of course, but many of these are done transabdominal and some vaginal, and this is the only thing you need is resolution, because with good resolution you can get to any diagnosis you want. So, and then now I showed you here the heart in the second semester. Now we can move to the heart in the first semester. You see here the typical images can be shown, like the 4-chamber view 2D and color Doppler, the short axis, the 3-vessel trachea view, and even by going to the slow flow, I can demonstrate by vaginal route the connection of the lung veins. We may not need it today, but if you are getting to higher resolution, you may go this way as well. And occasionally, you have a patient, 12 weeks plus 3 here. I had last week or 2 weeks ago, and I could not see anything by abdominal, so I switched from abdominal to transvaginal, and then by waiting a little bit, you can get a pretty nice image, even getting to the posterior fossa to measure the nuclear translucency, and then you hit the button because the baby is in a good position, and you produce a 3D picture. So these are, of course, the best 3D pictures you can do if you want to have an early nice 3D, and if there are situations where you may need to demonstrate the tiny vessels, of course, I could show you at 23 weeks and 30 weeks. But if you are seeking for the sensitivity, look at now how nice is the developing pericallosal artery, the straight sinus, and the superior sagittal sinus in these fetus in first trimester. Now, as I told you before, we can do 3D, and we can try to reach the level of Bernard. In a way, it's always a big idol to look and to develop things, but it's not only about the surface, but there are, if you take this example on the right side, you can now, with this new system, there is a new software, and where you can play with the silhouette and with transparency mode, combining both in different ways, showing on one hand, for example, the bones, and on the other, you can show within the same volume inside the brain to see the lateral ventricles and so on. I think I gave you a short overview on what can be seen on let's say, on 2D, on 3D, with the different flow, with color Doppler. And thank you very much for attention, and we look forward to see what Bernard will be doing magic.
So thank you, Alfred and Rabbi. Now it's my turn to talk about my experience on the Vuluson Expert 22. But I will not speak about all the features because it's too long, and I will focus mainly first on the use of the Radiant with B-mode, and also with this new transparency mode, the silhouette, where you can change the setting and you can see everything inside the volume. The Radiant, I think you understood what was the Radiant. With the Radiant, it's possible to have, this is made without Radiant and this one with a Radiant. If you look at this part, this is only an interface, and this is not correct, because when you have only an interface, this is not, you do not have thickness of the interface. This is more clear. So you increase the resolution. And this is really helpful in the first trimester of the pregnancy because you need really high resolution. And if you look at this picture, as Rabbi told you, I always am using the Radiant to the maximum because I want sharp border. And you increase the sharpness, but on the other hand, you have a high contrast. At the beginning, it was difficult to work with such a picture, but now I work only with this kind of picture. And also, we can use it with transvaginal probe. It's quite with really high resolution. And also, because of this contrast, you increase the contrast resolution. That means you can see the difference of structure between the different organs. Look at this, the lungs, the liver, the kidney. So it's really provide really nice picture. And I like to use it also, you know it, because I like to do the embryo. And this is at 9 weeks of pregnancy, the brain of the embryo, and with a Radiant, and you can see clearly here the border. What is this? This is not, it's not the lateral ventricule, it's a pericerebral space. And this is a spine at 8 weeks of pregnancy. This is a yolk sac, and you can see at 8 weeks of pregnancy here, an embryo with 2 lateral ventricules here. This is a 9-week embryo where you can see a cyst inside the umbilical cord. And this is a 9-week embryo with the 2 lateral ventricules here. So, but what I really want to show you now and to explain how it's works, it's a new silhouette. Because with this new setting of silhouette, it's possible to see everything inside the volume. That means, for me, it's no more a 3D ultrasound, it's a volume ultrasound. You have the volume and you can choose with a different setting what you want to highlight inside the volume. The silhouette, you know what is a silhouette. I was a fan of silhouette. And the launch was 8 years ago. And at the beginning, it was only to see the border between the interface between the liquid part and solid part. It was here on your E10. And this was a quintuplet. And it was nice also for the embryo because you can see all the liquid part inside the embryo, and especially here, the brain cavities. And it was possible also to use it for all the other liquid part later in the pregnancy. This is the stomach, the portal vein, the gallbladder. This is hydronephrosis. And this was the abdomen with the portal vein, the hepatic vein, the gallbladder, and this is a cyst of the liver. But now, we have a new setting, because before it was not possible to see the bones. It was possible, but really difficult. You have to change all the setting. But now you have two new parameters here, and you can interact with this parameter, and with this you can change everything inside the volume. And you will not use it for all your examination, but what I recommend is to save your preset. And I did a folder, the name is Tissue Bone, and with 4 different presets. One is for the skeleton, one is Tissue Bone 1, Tissue Bone 2 with 2 different settings, and one is more for the tissue, it's more transparent. And you will see what we can obtain. And this is a 12-week scan, so acquisition, with low quality. I take the acquisition in the first trimester with low quality, and now you can move inside without using the magic cut. You can see with the transparency what is inside this, and look at this. This is the intestine, and this is another one. And with this global transparency, you can see the different parts. You can highlight the bone. It depends on which setting you are using. Here, we choose a setting for the soft tissue, this one too. This one is more for the liquid part, so you can see the umbilical cord with a single umbilical artery. And here you have setting more for the bones, that means you will highlight the bony structure. And I like this kind of a picture, here's the face from the side, because maybe this is a new clinical application. It's always difficult to know exactly the position of the ear. And with this mode, because you can display the soft tissue and the bone together, it will be possible to define the normal position compared to the landmarks, that means the mastoid fontanelle, sphenoid fontanelle, and squamosal suture. And this is a fetus from the back at 18 weeks of pregnancy. And this is without using magic cut, just I switch to this transparency mode. And look at this, what we can see inside. And another case at 22 weeks, and I like to do it now, because at 22 weeks, when you do a scan in the second trimester, it's always difficult to fit completely the fetus inside one volume. And after you have to use a magic cut, it's really difficult. With this transparency mode, you don't have to use too much magic cut. You just move, you go front back, and you can see the complete fetus with this transparency. And this is at 33 weeks of pregnancy, and you can see the hand with the bones inside. And here, 3 cases. This is a normal one. We choose more transparency settings. You can see the heart, diaphragm, the position of the lungs, the stomach, the gallbladder, a part of the sigmoid here. And with this one, it's more for the bone and some soft tissue, intestine, the stomach, the 2 kidneys, the lungs. And this one with ascites at 13 weeks of pregnancy. And 2 examples of malformation. This was a right congenital diaphragmatic hernia. Already on 2D, you can suspect it because you can see the heart is not in the correct position and you have something inside the chest here. But this was, if you want to demonstrate, this one with more surface mode with the lung here, the liver inside the lung. And with the transparency mode, you can see a part of the diaphragm and some portal vein going inside the right chest, the heart is completely pushed on the left, and this was a gallbladder. And this was cystic hygroma on a fetus at 14 weeks of pregnancy, and also with a cleft lip with different settings here to demonstrate the cyst here and here under the arm. And this is more for the setting for the bones. And when you look at this, you can see also the cleft in the alveolar ridge here. And this was a hydranencephaly with a cystic hygroma, and it was a vasculopathy, it was a Fowler syndrome. And you can see here, and this one is a normal case. And this is I like to do it, you know, it's you took this transparency mode and you move inside, you go inside, and you can see the different parts. And more, I like to use the black and white pictures, that mean with a shade of gray. And this is the abdomen, and you will see the hydronephrosis here. This is a normal fetus here with a loop of the umbilical cord. You have something in front, but this is not a problem because you can see with the transparency, and you can see the heart, part of the heart. And this one was an embryo with a large nuchal translucency at 10 weeks of pregnancy, but with a normal outcome later, and with a normal nuchal translucency at 12 weeks of pregnancy. And look at this embryo, because I really like to work with embryo, and we can see inside the brain cavities with more detail. You can see here a cyst inside the umbilical cord, but this is quite frequent with no problem. And what you can see on the back, this is a spine. And this is seen with this mode, this silhouette mode. And this was the same embryo with 2D, with a radiant. You can clearly see the spine. And this also, it's new on the system. You can play with, this is a transparency mode with, we highlight the bone, and you can change the perspective renderings. That means you can use like a wide angle, you can go to wide angle to teleobjective, and this is a perspective rendering. And I will finish with this one. If you look at this one, it was made around 22 weeks, and look at this, you can see the complete position of the fetus, and what is this? Here, first I will put the fetus in the normal position. This was the normal position because the head was down. And what is this? This is the maternal aorta with the two branches. Why? Because it's a transparency mode, so you can see what is behind the uterus also. So thank you for your attention.
Après, une fois que tu prends le volume, je peux vous laisser montrer le perspective rendering.
Yeah.
Thank you, Bernard. Rabia, do you want to show us on the machine just a little bit some of the features, and then maybe Bernard can work through some volumes also?
Because I told you before that the essential part of the machine is the, let's say, the workflow, and so I want to show you some of the features of the machine. And let's say, first of all, when you are doing the scan, and imagine now how much time you are saving. You take this probe, for example, and you choose here, for example, this or that one to start. With this new system, look at here, there is the buttons of the icons of the probes. You click this one, it's called Respond Assignment, and then I can take, my favorite place is this one. I take this probe and put it here, and you see there is a light coming on here, and I take, for example, the 229 to be put here, and the transvaginal probe, so it can be put somewhere else. So, and then when we finish here means, now when I want to start, I take simply the probe, and it changes directly to the preset I've done, and I can start. The same I can do for the other probe. I have always one free, because when I do procedures, I don't want to put it in a place that it does not disturb me, that it cannot start by zero. So this is one of the features. The essential part, what we had a long discussion with the engineers during the last years is, it's ideally a kind of tablet, but it should be like the previous version. So we have now a tablet with many features of the tablet. One of the classical one is, for example, you can customize your system. So what you have here, you have a kind of icon showing you, let's say, some wheels. You hit it a little bit for a long time, you say configure, and you can move it like on your iPhone, or so move the different parts and to put it on the first page and second page. And the other part is that you have here also knobs like for the E10, but you have on the same times also these features are present here. So for example, when I'm scanning, I am old-fashioned person. So that means when I want to have a shorter angle, I will do the angle shorter this way. But probably the new generation, they don't want buttons, they want to touch. So the same feature is present here as an angle. And as soon as you put it here, I'm sorry you cannot see it, but you see it here, I can see on the screen the angle, number, and I can work with this. So the same with the contrast. So everything I'm touching here, I can see on the lower part of the screen. So I can use either the touch or I can use the button if I want. And this is one of the features I like very much in the system, that you can do both. And I will now show a volume, or have I forgot something on the touch? I will open a volume and show you what I also like on the, so the archive, yes, I want to show the archive. I'm using very much the archive, because the archive, I'm storing all my, let's say, sensible data, you know, the nice images, volumes for presentation and so on. In the previous archive, you have seen the name of the patient here. You cannot see it, unfortunately, there on the screen, but this is the name of the patient. But here we have all with icons. So you can see here, you can scroll and say, okay, I like this one and that one, and so you can choose the version you want. So let's we choose this one here, and we'll, can choose different size, and then I will open a volume and show you what. So this is the face with some shadow in the front. Now you see here the whole on the whole screen, but if you look at this screen here, I will show there are three steps you can use. One is the one I'm using here, that you have on the side the measurements, and on that it will not be shown because it shows only the screen. And you can use the extended view, but you can also, if you want to show that the patient, use the whole screen. And the trick is you need to hit the button for longer seconds, and then there is a full screen, and it fills the whole screen. And this is now, the complete screen is only for your examination and for your 3D playing. So let's go back now to the Magic Cut. So the Magic Cut, as I told you before, will be like this. In the past, we were using it, for example, like here, but today, because it is a touch and really very simplified compared to the previous version, so you can move this way, and then I will use my fingers to cut what I want to cut. In the morning, it's easy. In the afternoon, I use the knobs. So, and it's for the patient. It shows you that you know really how to manipulate the probe, and then let's cut this way here. And then you can use your both fingers, to magnify the image, undo less cut here. Or you do the same with the knob. So you have a combination of a tablet on one hand, but also on the buttons on the other. And this is really something I like very much. Bernard, you want to show us here how to play with the Bernard 2.0?
Okay. So already this is a good result, but what I will show you, but first, I don't want to have this full. How you did it? Rabbi, help me.
What have done wrong?
No, because it's stretched on the screen.
So you should go to the preset and change ultrasound area.
So I will take again the same. Okay, I will take another one. It's quite the same. I hope it will work. No, I'm sorry, because on your screen, maybe the picture is wider than normal. It's not the correct ratio.
Wait, we changed to...
Here you go.
Now it's okay.
It's okay.
Now it's okay.
Yeah.
Okay. So this is a 3D rendering. I will try to do the same what did Rabi. So I always choose routine, and I work only with HD Life. And this is a result with HD Life. And what I recommend, always, it's also to increase the shadow softness here. And I put it all the way between 110 and 120. And move the light position here. And this is a 3D rendering of the surface of the face. But now I will show you, because I use always on routine HD Life. This is my first for the external part. But what I use the most now is the tissue bone. And with the tissue bone, you can choose skeleton, and I will only interact with the gain. And here, this is a complete transparency mode with a profile. And also, I like to use this one. This is a tissue bone. And I fix the region of interest.
And you change only the gain?
I play with a post-processing gain. So this is nice. And I want to obtain, we will see what I can show you. We will start with 12 weeks. This is a 12 weeks. First, this is a multiplanar view. So you can see what was the volume at the beginning. This is a multiplanar view. I start with random mode. Here, this is a random mode with a surface mode with HD Life. Already it's not so bad, but you have something in front. And now I will use on tissue bone, I will choose tissue. This one. You can clearly see the amnion, and when you move inside, you can see the different part. And this is the global transparency, but you can choose for the bones here to highlight the bones and the different hyperechogenic part inside. And also this is a tissue bone too. So just have to change the settings.
Bernard, can you show the perspective rendering before you change?
Yes, we will try to do the perspective rendering on it. So it's here, perspective rendering, here. So this is what you can obtain with perspective rendering. It's ready for Halloween. So. This is one embryo. So first, to show you the quality of only of the data, the volume data. This is not a 2D, this is a picture from 3D volume. So you can move inside, and really important when you do it, you have different level of volume SRI, and the one is more sharp is the level 1, but you can choose other level. And look at this, this is, if you don't use it, this is without. This is without volume SRI, and this is with, and I like to use the level 1. Yeah. And from here, you can rotate and to obtain the sagittal view with the umbilical cord. And from here, I start to the initial position, We will do a 3D rendering. Render. I choose HD Life, routine. Okay. I increase the size of the box. And this is the embryo from the back. And also here you can see the legs and the umbilical cord. Okay, and I move to the new settings, tissue bone. We will see what is possible to do with this one. This is for the bones, but you do not have too much bone at that point of pregnancy. You can see sometimes only the mandible and the clavicula. Other settings, and this with the complete transparency mode. And also, it's really important when you do it to choose the level of voluminous array. And 1, you have more detail, and 2, 3, 4, it's more soft, but you lose some detail.
Bernard, you have
and I will
about
finish,
1 minute. Yeah,
yes, I will finish with one case. This one. This was made around in the second trimester of the pregnancy. And this is acquisition of the body from the thorax to the abdomen. And this is a result when the green line is here, that means you have a part of the placenta in front. So what I will do, I will use the tissue bone, and I will start with the skeleton. Here, you can see the bones inside. With this one, you can see I just move front back and I play with the gain. You can see the lungs, the heart, intestine. Okay, and now I will take, this is the other tissue bone too. It's quite similar, but a little bit more soft. And this one is global transparency. We put here. And this is what's happened when I increase and decrease the gain. Moving inside, you can see the different organs. And with the voluminous array, changing the voluminous array, to 1 you have more detail. 2, you do not have too much detail, but you can see better the stomach and the liquid part. And you have 3 and 4. Okay, so now what I will do, you turn here, and you move inside, play with again. You can see all the vessel.
So we have to remove Bernard, otherwise
Yes.
he will stay here.
No, I want to play with my system. Please.
Now,
on time.
I'd like to thank Professor Abu Hamid, Dr. Benoit, Professor Chowie for really helping to illustrate how we tried to address some of the challenges that you have today of being able to diagnose sooner, to be able to see with more detail, to be able to address the technically difficult patient, but also how the new system can help you with productivity and continue to help with the challenges that we have with lesser skilled staff. If you'd like to learn more about the systems, actually, Professor Chowie will be doing a live scan next on the first trimester. We also have Meet the Expert sessions the rest of today as well as tomorrow. So thank you for your time and attention. And as we finish